You're tuned in to The Dr. Kinney Show, and I'm your host, Dr. Erin Kinney, a naturopathic doctor and speaker dedicated to unraveling the mysteries of your body and guiding you back into balance. Let's get started. Hey, real quick, guys, before we start the episode, I want to share something that I'm really excited about. I know how hard it can be when your hormones feel out of balance, low energy, mood swings, and not feeling like yourself, which is why I created the supplement line Optimal Harmony. With natural science-backed ingredients, it's designed to support your hormones, stabilize your mood, and help you reclaim your energy and confidence, because when your hormones are balanced, everything feels easier. You deserve to feel amazing every day, so let Optimal Harmony line of supplements help you get there. Hey everyone, welcome back to another episode of The Dr. Kinney Show. This week I'm really pleased to have joining me Dr. Molly Hutto, who is an amazing acupuncturist in Annapolis, Maryland, where I practice. And she's here today to share about this really cool new treatment offering that they're doing called SAAT. I'm going to let her share about that, but first, thank you for being here. And I would love, she was on the show a couple years ago, so you can go back and listen to that as well if you want to listen to that. But we're going to talk today about that. But can you share a little bit about your journey into acupuncture and why you love it and all the things? Amazing.
Thank you so much for having me again. I'm really excited to be here.
Excited to have you here.
So I got into acupuncture a long time ago now. I was actually teaching high school in Baltimore, well, outside of Baltimore, and I was experiencing some pretty heavy depression and not sure which direction to go in life and trying to figure out my next steps. And I had gotten really into yoga at the time, and one of my yoga teachers was also an acupuncturist. So I decided to try and use it for chronic depression, and it was a game changer. One treatment completely got things moving in a different direction for me. And so it was so impactful on my life. I pretty quickly realized I need to do this for a living. And before you know it, I'm in acupuncture school. Yeah. So I've been in practice. I've been a licensed acupuncturist for about 12 years. And I opened Annapolis Family Acupuncture 5 years ago. We're a team of 3 acupuncturists. We also have a Reiki practitioner. And essentially, we initially specialized in mental health because that was what I got into. But a couple years ago, I took a course with Dr. Nader Solomon, who's an MD in Rockville. And he is the inventor of a cutting-edge technique called SAAT, which is the Solomon auricular acupuncture technique. SAAT has been validated to have near 100% success rates at eradicating allergies. It's amazing. It's so amazing that it sounds too good to be true. And when I was sitting in his course, I was thinking, like, there is no way.
Yeah, you're like, wait, I've seen people like trying to get better for things, and there's no way it could be 100%.
And I used to say there's really no such thing as a cure. We would talk about what healing looks like. This has proven me wrong, right? In most cases, we are able to permanently eradicate a patient's allergies. And so it's been amazing. I have completely redirected my practice into focusing on allergy eradication and autoimmune conditions. As you're aware, they go very hand in hand. And so this has been, I've invested a lot of money so that our clinic is completely equipped and prepared to handle any allergy that is thrown our direction. And there are some weird ones.
I'm sure.
Yes. We have patients come in and request testing or eradication for allergies to things like the titanium in their ankle.
That's a big one.
Yep. Or, breast implants, right? Yeah. So if somebody has something in their body, we, very, very odd food ingredients. Yeah. Some of these things I've had to really study up on before I saw the patient. But it's been really fun. It has completely redirected, or I should say re-enlivened my passion for Chinese medicine.
Because you're seeing such amazing results, you're like changing people's lives.
It's incredible. And, I was going to say, most healers go into a healing field because it had an incredible impact on their own lives in some way. And it's been really neat to specialize in something that, honestly, I have not personally been impacted by allergies.
Oh, lucky you.
I know.
That's
lucky
fantastic.
Me. It's wonderful. Yeah. But I had a few patients who had mast cell activation syndrome, MCAS, which we can talk about. And I didn't know anything about it at the time. And I was like, how do I help these people? Their lives are being ruined by this disorder.
is
it's really tough. And for those of you listening who don't know what that is, it's called mast cell activation syndrome. Basically, your system becomes sensitive to almost everything.
Everything.
Yeah.
And it's because you develop an allergy to your own histamine is what happens. And so it's a real snowball effect, a catch-22. You release histamine, and since you're sensitive to it, you release more histamine.
Yeah.
And so it creates this incredible system of inflammation that just is very hard to stop.
Yeah, the body can't. Like, I see it. It's interesting. I feel like most people with MCAS also have really, really, really low cortisol, which cortisol typically would come in, and like, cortisol is a natural prednisone. It's a natural anti-inflammatory. So if you have low that and you've got this histamine response, it just snowballs and people get crazy. Everything from GI stuff to migraines to rashes to fatigue. I mean, it's like, it affects every system.
Everything. It's crazy. And so, mast cell activation syndrome, something else I didn't realize is that COVID triggers MCAS. And so since COVID triggers MCAS, and most of us, whether we're aware or not, have been exposed to COVID at this point, a lot of people are walking around with like a low-grade MCAS situation. And when we do the testing in our clinic, we find that a lot of patients have MCAS, and it's wonderful to find it even if they weren't aware, because we can prevent something really serious from unfolding in the future. So we do a lot of treatment with MCAS. We can eradicate any allergy, be it seasonal, a food, and this includes food sensitivities. It doesn't have to be a full-blown allergy. We can treat alpha-gal, which is something
amazing. Which that's where when you get bit by a Lone Star tick, you will develop a pretty severe allergic reaction to all red meats.
Mammalian, anything with a hoof, right?
It's such a weird, it is such a weird thing. I was explaining that to my fiance, and he's like, wait, you can get a tick bite and then end up with an allergy to animal meat? And I'm like, yep it sounds like something in science fiction, but it is real.
It's wild. And with alpha-gal, being that we're in Maryland, alpha-gal develops with, and I wasn't aware of this, it's usually multiple tick bites. And you'll have no idea that you were ever bit by a tick because it's discrete. You don't necessarily develop the rash, right? And so people who come in with alpha-gal almost always have a co-infection of Lyme disease. And so we're also able to address that. Now, Dr. Solomon invented the SAAT technique, which is strictly for eradicating allergies and intolerances. But SAAT is an example of a broader spectrum of medicine called auricular medicine. Auricular is referring to the ear. And so auricular medicine started in the 1950s with a French osteopath named Paul Nogier. And so this is actually a really fascinating history. So Chinese medicine has been around for 5,000 years, but Paul Nogier, he took the ear map that was used previously for ear acupuncture, and he was like, this is not correct. And so using different patterning, he was able to discover that the brain relays information to different microsystems, the ear being one of those, in holographic form. And so a hologram is a three-dimensional image. And so what that means is that for every single anatomical structure in your body, there are 3 points that correlate to that structure in the ear. And so we call these phase 1, phase 2, and phase 3. And it's funny, we always say, they feel like they're out of order, which you'll see in a second. So phase 1 presents an acute presentation of what's happening. So if I right now were to dislocate my shoulder, the shoulder point in the ear in phase 1 would light up. Phase 2 is chronic with degeneration. And phase 3 is chronic without degeneration. So it's a little wonky, the order there. But what happens is the brain releases an electrical frequency through those microsystems when there's a pathology in either of those phases. So those points are actually constantly emitting an electrical frequency. And we use a tool, it's an electric point finder to measure the electrical frequency in the ear in real time for SAAT while you're being exposed to the allergen. But for auricular medicine, it can be for other things. I can ask the body, is there a heightened level of viral activity or a bacterial imbalance or, is there a fungal infection, anything at all, or hormonal imbalance. And while the body is exposed to that concept via homeopathy, so it's perfectly safe, the ear will emit that frequency. We locate the precise point, and that's where the needle goes. And so it has extreme accuracy. It is, results begin in real time. So if we were to, again, treat that shoulder injury and I were to place that needle in, it would shift it. Now, that's auricular therapy. Auricular medicine involves the diagnosis process. So using that same process, we're able to actually diagnose how severe a pathology is,
and what system it's affecting, possibly,
and what system it's affecting, cool. And where it is in the body, exactly. So we're measuring with auricular medicine something called the bioelectromagnetic field, which we call the BEF for short. And the BEF, every living organism has a bioelectromagnetic field, and when it comes into close proximity to something that the body deems as a threat, the BEF will expand. In a textbook perfectly healthy individual, the BEF is just 5 centimeters from the ear. So Paul Nogier, going back to him, he developed a system for measuring the BEF. Essentially, these electrical frequencies have a lot to do with that. And he put this system together. So Dr. Nader Solomon, who's the inventor of SAAT, studied with Paul Nogier's son and essentially put this beautiful package together to make it presentable to acupuncturists and physicians in the United States, and it's taking off again because it works.
Very cool, because it works so well. I mean, why wouldn't it? It should be.
Yep.
Right? I have a question for you. So let's say it's allergy season, fall or spring, and someone comes in and wants to eradicate allergy. Can you do it while they're continuing to be exposed to something?
Absolutely.
Okay, so it works that fast. Because I feel like there's other treatments out there where they're like, oh, we can't treat you for this during allergy season because you have to avoid the allergen for 48 hours or something, and it's kind of impossible to do that during allergy season.
Absolutely. I'm really busy right now, it's allergy season. Yeah. We're getting lots of phone calls. And so you can receive treatment during allergy season. We do let our patients know that for the first week, after needles have been placed in the ear, and they stay in for 3 to 4 weeks, by the way.
Oh,
for that,
are they SAATs?
No, they're actual intradermal needles. They're tiny needles,
cool.
And they're covered with different layers of adhesive, sterile adhesives. And they're super tiny. They're super tiny. And the patient doesn't typically really feel
even
them
know that they're there,
after they're inserted. But they go in the ear, they're covered. During allergy season, a patient may experience a heightened reaction for a few days.
Got it. Yeah,
and
which is pretty common with any sort of allergy treatment, right?
Very common, and we say you can continue taking your antihistamines if you need to get through that period. But then typically there's a drop, and it starts to improve. So it's fine to do. It won't push you into a danger zone of heightened reactivity.
So let's say you're treating them for spring allergies in the winter, would they still have a worsening? Or not necessarily?
If they're exposed to pollen.
If they're exposed to pollen. But if they weren't exposed to pollen, they wouldn't necessarily have the increase. Got it. Okay.
And that increase in sensitivity doesn't always happen.
Yeah.
But for those that it may. So, for example, if you're treated for an intolerance to gluten, and you ate gluten, you may experience some stomach upset.
And usually that's pretty common in any sort of homeopathic treatment. We call it an aggravation. It's like the body's just trying to reestablish balance. So it's like you go a little too far one way and then it comes back. And it usually means you're actually onto something. Like I always learn in homeopathy. Like I mean, we try to minimize aggravations, but usually if you aggravate, you mean okay, it's like a die-off symptom. It's like okay, we're on the right track. We just got to get through this phase and then we'll get better.
Exactly.
Yeah. And I think it's helpful for you to know that if you're going through something, because then you don't freak out. Like wait, I'm worse. What's happening? Yeah. You're like wait, oh, this is good. I'm worse. I'm getting better. Yeah.
I encourage all of my SAAT patients and auricular medicine patients to sit down with me ahead of time. I'll do free consultations
to understand what they're going to go through.
I want to explain it, and I don't want there to be any confusion or hesitance around the process or for people to freak out. Those Herx reactions, as we call them, are perfectly normal. They are safe. They can be uncomfortable.
Oh yeah.
With SAAT, it's very minimal. With auricular medicine, it can be more extreme.
Yeah. And that sometimes I think is the tricky thing for, we deal with that a lot here. A lot of the herbs and things we're using are homeopathic. Sometimes they do cause an aggravation, and education is such an important piece of that, right? Sometimes patients, and I feel like when I was first in practice, I would forget to warn people, hey, this might happen, it might not, and they're the ones that would call, be like, oh my God, what did you give me? Blah, blah, blah. And then I'm like, you just got to get through it, and then you'll feel better. But I feel like when people are expecting that, they're like, okay, I can deal with this. It's a day or two.
I have a patient who, so she's doing the auricular medicine protocol, which is divided into, there's phase 1 and phase 2. And phase 1 is a primer for the immune system. We talk about what are called the immunological blockages. And everything you take in phase 1 prepares you for phase 2, where we address the xenobiosis, bacterial imbalances, viral overload, and so forth, as well as specific concerns the patient may have. But this patient had a very difficult time getting through phase 1, which is not typical. Typically patients feel like more or less okay in phase 1, but every time she took one of the homeopathic remedies, she said that her gait was off and she had some visual symptoms, which she had experienced before. This is someone who uses homeopathy a lot, and she said anytime she uses homeopathic remedies, this happens. And it sounds very serious, right? But I did consult with Dr. Solomon over this case, and he said it is okay. These are Herx reactions. She needs to push through it. And finally, we sat down and talked about it, and she agreed to do it and came in just yesterday. And she's
feeling much better,
feeling fine, and she can take any homeopathic remedy now after like a lifetime of not being able to, and she's feeling great.
I guess it's some interesting. Some constitutions, like homeopathy, which is one of the gentlest, like theoretically the gentlest medicines, but some people are super sensitive to energy medicine. Like that will, and again, I think what he described is it's not bad. Her system's just, it's like her system's getting rocked a little bit.
And phase 1 of auricular medicine is based on pushing toxins out of the body. And as you know, homeopathy is all about resonance and vibration, and so it's perfectly safe. You're not introducing really a true substance to the body. You're introducing a vibration that will not allow a negative resonance to exist in the body, such as metal toxicity or dental toxicity, sinus, whatever. So it pushes all of that out, and then on the other side of it, you feel amazing. But you have to get there. And I always say, in order to if you're trying to clear toxins, it's like driving through a bad neighborhood. In order to get out, you have to drive back through it. So there's this element of coaching that I feel beholden to, helping patients understand that these symptoms are in fact
and I
expected.
think the coaching piece is such an important part. You guys know I talk about this on the show a lot. Like your brain controls everything, and sometimes if you've had a bad reaction before, like there's a little bit of fear that comes with that, and then you might be almost like creating a little bit of it. So it's good to understand, hey, this is not a bad reaction. This is okay.
This is good.
Mindset work I think goes. It's almost like you have to do it when you're doing any of these, kind of more out of the box treatments, because it's not the norm, right? It's not kind of what we were grown up teaching or taught to have the body heal.
And I'm grateful Dr. Solomon is available to his students in a forum, so we can consult with him really at any time if we're confused or concerned about something. But I've gotten to the place with my practice in auricular medicine where I know it's safe. And I think when I first began practicing this, we care so much about our patients, right? And we want to make sure that they get the best results possible. But anytime I have concerns or questions about a symptom a patient's experiencing, I consult with him. And at this point, I almost never do anymore, because the answer is
always like, it's going to be okay.
It's going to be fine.
Well, I mean, I think when you're using this type of medicine, it's inherently so safe, right? And you're basically tapping into the body's innate wisdom, right? And like and I think a lot of us, like we're so busy and there's so many things and our body's trying to deal with it. Our bodies have kind of lost the ability to like tell us what's going on. But this type of medicine is really, you're not giving the patient a substance. You're giving them an energy that's going to help their body like clear negative energies and like bring back their true like good constitution. So it's so safe.
It's very safe.
Which is why, and I think it's why it's effective, because it's like using your body's own innate healing capability.
Absolutely. And I think homeopathy gets a bad rap from those who don't understand alternative medicine. But personally, even before I was an acupuncturist, I used homeopathy with incredible results. I've been a patient of yours and used it with incredible results.
It's amazing.
It's incredible, and it's powerful, and results are often immediate. You can feel it working. So, I think it's just important for people to give these remedies a chance and to understand exactly what you said. Allow your body to call on its own innate wisdom to heal itself. Because there's nothing that's going to heal the body better than the body itself if you allow it to.
I think that's a perfect thing to say. And I think you touched earlier when we first started talking about, the connection between allergies and autoimmunity. And I kind of want to circle back to that and talk about that a little bit. An allergy is essentially your body's immune system is overactive. Your pollen is benign, right? It is not something we should react to, but our body is treating it like it's a bacteria infection. So, an autoimmunity is when the body is immune system is overactive and starts attacking itself. And so oftentimes a patient that has a lot of allergies can sometimes be more prone to autoimmune type situations,
Absolutely.
right? So I think like eradicating these allergies, you are setting the body up for not getting autoimmune diseases, right? 100%. Do you want to speak about that a little bit?
Absolutely. So something I've been formulating in my own brain a bit through doing this work is that there's a big difference between allergies with a lowercase a and allergies with a capital A. And fundamentally, it's what you just described. It's the difference between just a regular allergy and an autoimmune condition, right? So when a patient comes in and they're saying they just have some low-grade seasonal allergies and they'd like to be done with it, we're looking at 2 to 3 treatments total, and then they're done for the rest of their lives with SAAT.
Yeah.
It's incredible. But when a patient comes in and they literally have a rap sheet of allergies, whether it's foods, every single pollen you can imagine, and I have a patient who's reactive to her new car. I mean, anything you can imagine, right?
Yeah.
These people have something much more severe going on, which is the body essentially cannot decipher between, like you said, something that is benign and something that is in fact toxic.
Yeah.
And so when that happens, it really does come down to doing a bit of an autoimmune reset. I often encourage those patients to shift gears and do the auricular medicine protocol instead of SAAT, and then we add SAAT into it.
And probably you're looking for something that could have gotten their immune system, right, with the auricular medicine,
COVID.
looking for Lyme, COVID, EBV, like some of these, major infections
mold
that
exposure.
mold exposure is a big one. And we've talked about that a lot on the show. These things that they basically put your immune system into a tizzy. The immune system is like, I'm trying to kill this thing. I can't find it, but let me attack everything else in my sight, right?
Yeah.
And that's one thing, and I call those like internal stressors. If you have that on top of like a super stressful life, stress is going to activate the immune system to turn on. And if there's nothing for it to fight, guess what? It's going to fight pollen. It's going to fight food. It's going to fight its own tissue.
Because
it's
right.
It's like you've activated your soldiers, and they're like, we need something to fight. We better find something.
And then you compound on top of that the impact of leaky gut syndrome, right?
Oh, yes.
So if the epithelial lining of the intestines has been compromised, then some of those microscopic toxins break through into the bloodstream, and then different antigens attack, and your body will just continue to attack that toxin. And so that's another component that I'm often finding we need to address to really get this entire system to seal and to be remedied. My entire career, I have felt like Chinese medicine, acupuncture, it's incredible, right? As you know.
It's an amazing therapy.
It's a complete system that can address just about anything. It is internal medicine. But it did feel like something was missing. I felt like I was doing constant healing work, and patients needed to come to me
all the time,
forever. And
because it's like you would realign their system. They go out and they do the same things that gets their system out of alignment, correct? They come back and they're like, oh, I ate pizza and drank beer and now I'm feeling crappy again.
Absolutely.
And you're like, all right, well, let me do the same treatment again.
Let's do it again. And I have a lot of patients that I've seen now for 10, 11 years, and I love them. They're amazing. But in the back of my mind, there was this element of guilt that we're not curing them. But auricular medicine actually addresses that foundational level. It really gets down to the root cause of what is happening, like you said, an event, right? So whether it's mold exposure, Lyme disease, or whatnot, that led to the patient being in this cascade effect of their immune system over responding to everything. And so when we're able to get to that foundational root cause, we can actually treat that. And the patient stops overreacting.
Well, and also, I mean, from what you're describing, it sounds to me too like you're changing the way the brain is reacting to those things, right? So this is something I see in a lot of patients who, like, let's say they have a history of Lyme disease. Like, I had a girl come in the other day, had Lyme in her 20s, treated, didn't have any problem for 10 years. She then was living in a moldy place, and all of her Lyme symptoms came back. Her Lyme is negative, like completely negative. We've done gazillions of tests, and it's like, she's like, but I feel like I have Lyme. And I'm like, no, I think your immune system got a little bit, skewed, but your brain remembers so deeply what it was like to have Lyme, and it's almost like it's reacting to something that's no longer there.
It's almost like it's cerebral a pattern. PTSD.
It is, and that happens a lot to us. Our brains don't really like change, and they're like, okay, if this is a pattern we've been in before, and you get something even slightly similar to that feeling, then the brain's like, oh, well, this must be it again. And so I think what you're doing is you're changing the way the brain is responding to something that maybe is there, but maybe it's not even there anymore.
Maybe it's not there anymore, right? And so auricular medicine and SAAT. So SAAT is primarily the use of the needles in the ear. But auricular medicine, primarily we're using a series of homeopathic sprays for that treatment. However, with our auricular medicine patients, I almost always combine the two.
Yeah.
I'm doing points in the ear and I'm doing the sprays. The sprays are going to course out the actual toxins that led to the situation, but the auricular therapy piece in the ear, the needles in the ear, is addressing the neurology of the system, of the situation. And it's fascinating. Yeah. It is fascinating. We have children coming in who have severe ADHD. My own son is autistic, and I have some autistic patients.
Have you treated him? Do you treat Emmett?
I do treat Emmett.
Oh, that's amazing.
It's amazing. So he told me recently, he's actually never really let me do much with him, but very recently it was his own idea. So he comes in now regularly for treatment
at the
clinic. It's amazing. And so we are seeing really great results, but I'll leave that out for, for his business. Yeah. But, with our patients who come in, kiddos who are autistic, we're seeing great results with them too. We can use points that directly impact. Actually, let me back up. I want to explain auricular therapy and auricular medicine are two different things. Auricular therapy refers to treatment in the ear. Auricular medicine is the diagnostic system, right? So using auricular therapy with treatment in the ear, I have this very fancy pen, this tool that I'm able to use in kids that are scared of needles. Needles in the ear can be quite sensitive.
Painful,
Yeah. So this is pain-free. It just beeps. This is measuring, again, that electrical frequency. And then once we find it, it provides a little electrical stimulation that you do not feel, that you're not actually aware of to that point. And so using Dr. Paul Nogier's ear map, which is extremely complex, I have an entire textbook on it, we're able to locate points that represent the acute, chronic with degeneration, and chronic aspects of the amygdala, the pineal gland, the hippocampus, the prefrontal cortex, right? So if we understand using modern medicine and modern science what areas of the brain may be impacted by autism, we
really
can go in and treat those specific spots using this microsystem.
It's very cool.
It is very cool, and it's relaxing, and you get results right away.
Yeah. That's amazing.
It's amazing.
So that would be the auricular therapy you're talking about.
That's auricular therapy.
So the medicine is you're going to go in and you're going to help figure out like what's going on in someone's case, and then you would then refer them to the auricular therapy.
Correct.
Very cool.
It's neat stuff.
It's very neat stuff.
Yeah.
So do you want to talk a little bit about your clinic, like how people, and I know you have other providers, do you want to talk a little bit about them?
Yeah. So we're a clinic of 3 acupuncturists, and we have a Reiki practitioner as well.
Yeah.
My 2 acupuncturist colleagues are Nicholas Vespucci and Dr. Duania Wilson, and then myself, and we have a lovely front office staff, and then our Reiki practitioner is Dr. Katie Martino, and she's awesome. She's such a neat woman, and I obviously just give her space to do her own thing with her Reiki practice, but our patients love her. But with the acupuncture, Nicholas specializes in the treatment of anything cerebral, so stroke patients, patients with MS. He's really great at treating different types of headaches and migraines, and then he also has a lot of training in women's health.
Great.
He's wonderful, and he's just a gentle soul. Our patients love him. And then Dr. Duania, she has a really complex background. She has a background as a social worker. She also has a background as an esthetician, and then she's a doctor of Chinese medicine. So she does a little bit of everything, and she actually is about to undergo the SAAT training as well.
Oh, she is? Oh, because probably you're so busy, you need to have someone else that does it.
I need to, and actually we'll have all of our practitioners doing it at some point. We're just sort of rolling it out.
It sounds like, why wouldn't you?
It's busy. Aside from being busy, it's gratifying, and I am essentially rebranding AFA a bit for immunity, right? We're looking at our focus being immunity. We're still going to address the mental health piece and women's health.
It's interesting, I think I was going to say this earlier, like, I know for myself, when my allergies get bad, my mental health isn't great. I get anxious. Like, usually that's the first sign for me that allergy season has hit. I get anxiety.
Interesting.
Yeah. And it's the histamine in my brain, right? Like, that's what it is. Histamine crosses the blood-brain barrier. I don't get too many other symptoms, but I will get I'm like, it's allergy season. I should probably go on my allergy protocol, or I need to come in and see you.
I would love to see how you do with that, and if we can eradicate that for you. Because it's just...
But my point being is that immune issues have such an impact on mental health, right? And I think sometimes that's often overlooked. Like people are like, wait, no, I'm going to take my allergy meds. That has nothing to do with my depression or my anxiety.
Absolutely.
But wait, it kind of does.
It does. Dr. Solomon talks about this in his class. So there's a difference between an allergy and a sensitivity.
Yeah.
And a mental health impact would be considered a sensitivity.
Yeah.
But at the end of the day, it doesn't really matter.
Yeah, it's still like, it's still immune dysregulation, right?
It is still immune dysregulation. We look at symptoms like mental health concerns. And I actually have this myself. My depression goes into full gear if I'm inflamed.
Oh yeah.
And
your brain gets inflamed, right?
Your brain gets inflamed, and it's become something that for me is a bit of a guide. I know that I need to recenter and clean stuff up if I'm feeling that way.
Yeah.
Yep.
Yeah. Super cool. Thank you so much. This is
welcome.
Amazing information. I hope you guys enjoyed this. If you are local, another question. So if you're local and you need this, please call. Where's the best way to find you? Website?
So website is www.annapolisfamilyacupuncture.com.
Okay.
I'm on Instagram.
Yep.
I'm also on Facebook. And I will say, yes, most of our patients are local, but we do have people who travel particularly for auricular medicine. SAAT, you come in for your first appointment and you don't come back for another month.
Got it.
For
you could do travel.
Absolutely. And for auricular medicine, you have your first appointment. Your next appointment isn't for 2 months.
Got it.
And then after that, it's really optional if you come back at all.
Yeah.
A lot of our patients will have us ship things that they need to them if they're far away.
Yeah. And for people that travel might not be in their budget or whatnot, where can they find someone that practices SAAT? Is there a good place for them to go?
Dr. Solomon's website is, if you look up Dr. Nader Solomon, you'll find it. He does have a list of practitioners, and this is important. SAAT is taking the world by storm, and so there are people who are practicing SAAT who have not actually been certified in it. It is important to find someone who's certified because it is much more complex than I explained here, and you want to find someone who really knows what they're doing.
Yeah, cool.
Yeah.
Well, that's fantastic. Thank you so much. Again, I hope you guys enjoyed this episode. We'll put all the links in the show notes if you're interested in checking her out, and we'll see everyone next week.
Thank you for tuning in today. If you enjoyed this conversation, be sure to connect with me on social media to find more helpful tips and information. You can find me at Dr. Kinney on all of the platforms. And please be sure to subscribe and leave a rating and/or a review. This helps grow the show so more people have access to this knowledge that leads to empowered healing. Love and light, and see you next week.